Hi, my name is Dr. Sarah Bjorkman and I am a board certified OBGYN and a first-time mom. And a couple weeks ago we did an episode all about how to hopefully prevent perineal tears or lacerations when you're in labor. And so this week I want to talk to you about how to take care of your bottom after delivery if you do end up with a tear, giving you some of my medical expertise as well as my in real life knowledge, having just gone through this myself. So we're going to get into it right after this. So, as we talked about in that episode, all about preventing perineal tears, which is linked here, anywhere from 50 to about 80% of women may experience some kind of tear when they are giving birth. And there's different degrees of tearing, which we talked about. But the question is, how do you take care of that injury after birth? So today I'm going to go through the products that will help you be as comfortable as possible and heal as quickly as possible, okay? If you haven't subscribed to our channel, please do that. We love bringing you guys pregnancy, postpartum, parenting topics, and we want you to stay with us. So here we go. You have had a baby or you're about to, and you want to know what to do to take care of your bottom postpartum. So the number one thing that you are going to want to have is a PERI bottle. So most hospitals have something just looking about like this. You are going to want to fill this up with water. When you go to the bathroom, you are going to want to squirt this to clean off your vulva and vagina. My pro tip on this is if you have any labial lacerations, you may even want to squirt water while you are peeing because urine can really burn on an open cut. So you use this so you don't have to wipe aggressively, and you can also use it to kind of distract you while you're peeing. So step one, PERI bottle. The next thing you're going to want to do is you can gently pat your perineum and your vulva dry with a washcloth or some toilet paper. After that, the next thing you're going to want to do is to take your DERMAPLAST. Often you can ask for this at the hospital and your doctor can prescribe it, but this is basically just a topical anesthetic. So after you pee, you use your PERI bottle, you are then going to spray this on your labia, your vagina, your perineum, and your bottom. And it is a nice cooling, anti-itch, kind of numbing medicine that really helps. Now, if you are one of the lucky mamas who is also dealing with some really painful hemorrhoids, which you may be at that point, you are going to want to get yourself some witch hazel pads, okay? These are circular little white things that have witch hazel on them. You fold up a couple of these, put them between your cheeks, and that really helps with that hemorrhoid pain. The next thing you're going to want to do is get yourself some jumbo pads. Again, the hospital will usually have these. Take as many home with you as you can, but you want a nice jumbo pad that you are then going to put on the inside of your disposable undies. Okay, these things are amazing. They're so comfortable. They're huge. They fit every body, and they're super comfortable. So I was very into the disposable mesh undies, loved them. So mesh undies, pad on the inside. Some people prefer Depends, but those are the key things to help your bottom heal and be comfortable. Some other things that I found were really, really helpful were instant ice pads. Okay, so Freedom Mom makes some, and I thought these were amazing. The hospital also has some of these, but basically what you do, it's an absorbent pad, and then it has like an ice pad on the inside, so you break it and it cracks, and then the whole pad gets really cold. My pro tip for this is to sprinkle just a tiny little bit of water on the pad, and it makes it so much colder. So you can sit on these for about 30 minutes at a time is what I found before then they got warm, and then you just throw them away. And so you can do this a few times a day to help decrease swelling. You know, if you have a sports injury, you're going to ice it. It's the same thing. If you have an injury to your bottom here, you want to ice it and it'll really help. The other things you want to be thinking about are taking some kind of pain medication to help you feel comfortable. And those are going to be things like Tylenol and Motrin. If you don't have any allergies or contraindications, you can take those every 6 hours, kind of around the clock, that first week or so that you're home. That will really help with your pain. Another thing, everybody dreads that first postpartum poop, especially if you have stitches in your vagina and in your perineum. So something I recommend is some kind of stool softener, whatever your stool softener of choice is, Colace, Miralax, whatever works for you. Start taking that as soon as you get home so that it's more of everything falls out. You do not want to be pushing anything out while your bottom is still healing and you still have stitches. Other things that you can think about, you can take SITZ baths. So you don't want to take a 15-minute bath, okay? And your cervix is still open. There's a theoretical risk of increased infection, so your doctor isn't going to recommend a bath, you know, for the first couple days. But you can take SITZ baths, you know, sit in the tub for 10 minutes, splash some water to make sure your bottom's nice and clean. Some people love these, like some bath salts. It's like an Epsom salt soak, and that's really wonderful and can be really comforting on your bottom. Another thing, if you aren't into the witch hazel pads, you can use this. It's a witch hazel healing foam that you can also put on your perineum to kind of help. So you can use the DERMAPLAST on your perineum. It's a topical numbing. And then the witch hazel is kind of an antiseptic that helps in terms of healing and anti-infection. And so you can also put this on your vagina and perineum. Things that you want to look out for when you are postpartum is if you notice that you are having really exquisite pain that isn't getting better, you want to talk to your doctor right away. If you notice that you are having kind of like foul smelling discharge from your vagina that is purulent or green and doesn't smell good, those are things that you want to talk to your doctor about. If you have a fever above 100.4, call your doctor right away. And so those are just things you want to call your doctor about. Other things to think about, especially if you have had a 3rd or 4th degree laceration, again, is going back to make sure you're taking a stool softener religiously, because with a 3rd or 4th degree tear, there was a tear in your anal sphincter, and so you want to make sure that you aren't putting any stress on that at all. Of course, if you have any questions, talk to your OBGYN, but hopefully this helps all of you be able to take care of your perineum. So having lived through this and as an OBGYN, something for you to think about that can be very helpful when recovering from a tear or a perineal laceration is pelvic floor physical therapy. And this is something very often that your OBGYN can give you a referral for or put you in touch with your local pelvic floor physical therapist. And so if this is something you have access to, I would absolutely recommend you see them because they can help you regain the strength in your pelvic floor, make sure those muscles are working correctly, show you how to do exercises, and this can help down the road in terms of helping prevent incontinence and pain and all sorts of things. And so postpartum, after you give birth, something I would absolutely look into, talk to your OB about, is seeing a pelvic floor physical therapist because they are amazing and will really help you restore that strength and function in your pelvic floor. All right, guys, those are my favorite things that will hopefully help you be comfortable and heal from any tears that you have from giving birth. Everything is linked in our Amazon store or in the description below. If you have any questions, please leave them in the comments. And if you all have anything that you loved that really helped you recover postpartum, please leave them here so that other mamas can see. Thanks for being here. We will see y'all next week.
We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.